Suppose that there was a condition which caused thousands of Americans to die each year, and caused tens of thousands more to live severely hampered lives, filled with costly and uncomfortable medical treatments to keep them alive. Now, imagine each year that America produced a substance that would cure this population, but we ended up throwing most of it out, and only a fraction of the afflicted received proper treatment. Sounds improbable, right? The fact is, America is currently facing a crisis like this, a shortage of organs for those that need transplants. Luckily, a solution is in sight: routine organ recovery. Routine organ recovery is at its core a policy that makes all deceased potential organ donors. Rather than having it as an opt-in program that occurs when registering for a driver's license or signing up through the federal government, routine organ recovery would automatically assume consent to donation after death. The harvesting of organs would occur with a frequency that depends on the number of recipients currently on organ waiting lists. The reasons for this are manifold, but two arguments for this policy stand out. One, the reductions in deaths, morbidity, suffering, and healthcare costs, as well as two, preventing and curbing the U.S. involvement in the organ black market. First, let's look at some statistics. Ever since 1989, the number of people on the waiting list for organs has skyrocketed. In a 10-year period since that date, the number of people requiring a transplant has gone from 18,000 to over 100,000. Unfortunately, the number of donors has remained stagnant over this time period, indicating that current donation policies are not effective now and certainly will not be in the future. This brings us to one of the most compelling arguments for doctors to routinely collect organs: the sheer number of lives that can be saved for those needing transplants. In 2011, 6,669 patients died while waiting for an organ donation to become available. That's almost 18 people per day. Furthermore, we need to remember that those in need are suffering every day up to their transplant. Current estimates show that those in need of an organ donor average about 12 QALYs, or quality-adjusted life years, less than their healthier counterparts. Finally, adequate organ reserves will greatly decrease the amount the federal government spends on healthcare each year. For instance, in a special provision, Medicare offers coverage for those in need of services to treat end-stage renal failure. With a current estimate of 93,000 people on the kidney waiting list, this adds up to a huge bill. However, current studies suggest that kidney transplants would save an average of $4,000 per person per month, compared to simple routine dialysis. This brings me to my next point. Routine organ recovery will assist in curbing the U.S.'s role in the organ black market. So, we can see that the shortages in the number of organs available is the product of the low supply combined with high demand. With this great demand, those in need of life-sustaining organs often turn to more illicit services to receive the transplant they need. With the increase in demand and high cost of organ procurement, Americans are increasingly flying overseas to take part in medical tourism and get necessary transplants. However, this comes at the cost of often not knowing where organs come from. India and the Philippines, two countries that are popular in this market, coincidentally are considered a global hotspot for buying and selling organs across countries. Organ brokers routinely convince the poor and uneducated to sell their organs, which often leads to hardship. For example, a rickshaw puller in Bangladesh was convinced to sell part of his liver because he was convinced by a buyer that he did not need it. Now, he can't walk, breathe properly, or even hold a steady job. Even in the United States, hospitals are now a major concern in furthering this organ black market. There are no current standardized requirements of due diligence that a hospital must have when it screens potential sources of organs to be donated. Rather, the only national guidelines that exist are merely suggested by Medicare and other nonprofit groups. What does this mean? Since hospitals are largely able to decide on how much due diligence to carry out and source the organ, it introduces the incentive to accept organs from less than credible sources. Combined with this is that hospitals attempt to bring in as many organ transplant surgeries as possible. Medical services of this type are highly profitable for hospitals and doctors, often creating tens of thousands of dollars in revenue. Take a look at the following chart, which enumerates the total costs received by hospitals. A routine heart and lung transplant costs over $1,200,000. This lack of due diligence and incentive to drive in surgeries furthers the risk of organs coming in from the black market. In fact, the first reported case of organ trafficking in the United States occurred in 2009, when a man from New York was caught planning to purchase a kidney from an Israeli citizen and have it transplanted in a local hospital. Based on this, we can see that guaranteeing a stable supply of organs benefits not only those in the United States, but the poor in other countries. In closing, we can now see why it is imperative that we start to incorporate routine organ collection into our nation's healthcare system. While some may argue that this is an attack on our personal liberty, I'd like to leave you with this one final thought. We regularly give up our personal freedoms already for the common good. We allow ourselves to be drafted into the military during wartime, allow our children to be required to have vaccinations to use our public school systems, and pay taxes to our governments. By allowing routine organ recovery, U.S. citizens can, in death, breathe life into future generations.